Hi, I'm Dr. Sunil Richardson. I'm a maxillofacial surgeon. I work out of India currently, especially during the lockdown. I also work out of the Middle East, and I hope to get back once things settle down. All right, today I'm going to talk to you all subscribers about the type of rhinoplasty that a lot of patients in this part of the world need. And I tend to call that augmentative rhinoplasty, which means you got to augment the nose or you need to add on to the nose. Now, why is this procedure needed for a lot of patients? Very simple. A lot of us in South India, and for that matter even in India, we have something called as a thick nasal skin, and the dorsum or this part of the nose is flat. So many of my patients or many of the viewers or subscribers or others keep asking me, doctor, I have a flat nose, what do I do? Now, when you have a flat nose, there are two things that happens. The bones can get flared out. So you're going to get the base nearer, but you also got to build up the height. So this part is the base, that needs to come closer, and that's usually done with osteotomies. So you break that bone and mold it into place. Now that technically is not augmentative rhinoplasty because a lot of patients need that. And that is just an osteotomy for doing rhinoplasty. But when you do that and also build up on this part of the bone, so you want to get it forward, so you want to get a sharp line or it's really narrow, then that is called augmentative rhinoplasty. So how do we do this? One of the things that we have to understand is that the best product available is the cartilage for this. And the best cartilage there is the rib cartilage. Now in certain countries you get to buy these irradiated ribs from the market. That of course then you can use, but like where I work both in India and the Middle East, I have to harvest of the patient's own body. And I think it's even better to do that because if you're good with it, it doesn't take more than 15 to 20 minutes and it's absolutely safe as long as you know what you're doing. So I've done hundreds of these cases for harvesting rib. I like the cartilaginous part most of the times. So we take this cartilage and then we shape it up. So you've got to build the shape on the cartilage, and we also cut some slivers of these cartilages. And then those slivers are put in pockets on the sides. We call these grafts. So we can put them on the sides, we can put them in the center, we can put them on the top. There are innumerable techniques of grafts mentioned. I use a lot of them too. So based on the cases, you can use a spreader graft, you can use a marginal rim graft, you can use a columnar strut graft, a septal extension graft, and so many technicalities. But to simply put it, these grafts basically help us align the nose. Okay, so the main part is augmentation, and then that cartilage bit is also used to build up the rest of the framework. This is what I call augmentative rhinoplasty. We also have other materials that are commercially available, like for example Medpore or silicone that you can use, but then I tend to use these only on patients of a medical issue or who would not want it for some reasons, because these are not as good as the patient's own cartilage. And these have higher rates of infection, higher rates of rejection, even many years later. Meaning these materials never get incorporated or never get absorbed or never becomes one with the patient's body. While when you take the cartilage, that is not the case. So that's why that's better. So how is this different from the other rhinoplasty? Another thing as far as the patients are concerned is the time it takes. So you're going to look at 5 to 7 days here at the hospital while we do this kind of augmentative rhinoplasty. Also, your further recovery is going to get added by another week, so you're probably looking at 3 weeks and all. After that also, there is going to be a lot of healing happening all along till about 6 months or even 4 months maybe in some patients, but that's going to be happening in such a way that you're not going to notice it, nor is a person who's interacting with you going to notice it. So that's but still healing, mind you. So during this healing phase, we recommend patients not to play contact sports or swim or do a lot of exercises, and so that's very essential. Now with regards to the scar that is there when you harvest the rib, it's very simple. When it's a lady patient, a female patient, it's going to be no visible scar because it's a nice, neat inframammary incision. Absolutely no one can make it out. But for a guy, there can be a faint line that's visible. I tend to put it in the groove here, but then you can sometimes see that small line, nothing more. And with time, it really wears off. So I think this is something I want our subscribers to understand, that if you have a hump in the nose, we reduce it. The different types of rhinoplasties, I've already made a couple of videos on these, but augmentative rhinoplasty is something that's very specific. I also like to do an open technique for a lot of my patients. It doesn't mean that I don't do closed techniques. I do closed as well when you have a nice tip and just you don't have the dorsum that's not augmented. So basically, depending on the type of nose, depending on the nose that we're going to fit that particular phase, we will do the correct amount of augmentation. How much augmentation? Well, I will suggest we will take scans, but also depends on what the patient wants. So that's going to be something we're going to discuss in the consultation, and once we arrive at an amount that we think is fair enough, then we can do a morphing image or something, and then we can go ahead with the surgery. All right, thank you. If you still have any more questions, definitely shoot your questions to us on YouTube. You can send in the comment area, we will be able to reply for you. Thank you.